Hello and welcome. My name is Grace Newmeyer, and I am the Marketing and Communications Manager for the Canadian Lymphedema Framework. Before we begin, I would like to extend a special thank you to our Diamond partner, Bauerfeind Canada, for their generous support, not only of the CLF, but of the broader lymphedema community. Many of you may already be familiar with Bauerfeind's high-quality compression products, which support individuals living with lymphedema, lipedema, vascular conditions, and even athletes. The company we know as Bauerfeind Canada is actually the Galien Group, a Canadian-owned medical device distributor based in Laval, Quebec, who is the exclusive distributor for Bauerfeind and Bosal products in Canada. Before we begin tonight's live stream, I would like to thank everyone who submitted questions for Bauerfeind in advance. We have set aside approximately 15 minutes at the end of the presentation for a Q&A session. If the Bauerfeind team is unable to address all questions during that time, we will include contact information for Bauerfeind in our follow-up email so you can connect with them directly. Today's presentation is being recorded, and a link to the recording will be sent to all registered attendees in the coming days, so please keep an eye on your inbox. Now, it is my pleasure to introduce Bauerfeind Canada's presenter, Marie-Ève Letellier. Marie-Ève is a kinesiologist, certified lymphedema therapist, and clinician researcher with experience spanning clinical practice, research, education, nonprofit organizations, and the compression industry. Her work focuses on lymphedema prevention and management, as well as the assessment and treatment of lipedema. Passionate about evidence-based, patient-centered care, Marie-Ève works to translate emerging research into practical approaches that improve outcomes for people living with lymphatic disorders. This evening, Marie-Ève will explore lipedema, lymphedema, and obesity, three distinct chronic medical conditions that are frequently misunderstood or mistaken for one another. This confusion can lead to delayed diagnosis and ineffective treatments that significantly impact patients' quality of life. The goal of today's webinar is to help healthcare professionals better distinguish between these conditions and apply the most appropriate therapeutic strategies. Marie-Ève will also discuss the role of compression therapy in management, including an overview of Bauerfeind's Curaflow garments and Lympha-mat compression device. We are looking forward to this important and informative discussion. Without further ado, please join me in welcoming Marie-Ève.
Thank you, Grace, for this nice introduction. So tonight I'll be talking to you about lipedema, lymphedema, and obesity, putting an end to the confusion, or what I call LUL, aka being lymphedema, obesity, and lipedema. Stop laughing and start understanding. One important thing to know is those three topics could have been on its own like a full week webinar. So we're doing a brief overview of these conditions tonight. So as Grace mentioned, so briefly, the objective of tonight is to distinguish the key characteristic of the three conditions, understand their similarities and differences, clarify the diagnostic challenges, review the therapeutic approaches suited to each condition, and explore the role of compression in the management. So one thing, Bauerfeind is 100% made in Germany and distributed in Canada by a 100% Canadian company. So everything is made in Germany, from the fiber to the whole confection of the garment. So to laugh or not to laugh, why is there confusion? So lymphedema, obesity, and lipedema, they were quite often confused as a condition, which frequently delay the diagnostic, have a major impact on quality of life. And some consequences of misidentification, it leads to ineffective treatments, frustration from the affected person, and possible worsening. So therefore, we need a clear and early clinical distinction to improve the management. So why is there a confusion? So quite often, those three conditions can have a similar visual presentations. The three of them are chronic conditions. Also, they use different stages to describe the condition, and it's mostly women that are affected. And in addition, the therapeutic approaches are similar, and self-management will include compression, exercise, skincare, and nutrition for the three of them. And there's a lack of medical awareness. So by definition, lymphedema is an accumulation of protein-rich fluid in the interstitial space following damage to lymphatic vessels and nodes, which is called secondary lymphedema, are due to the absence or malformation of lymphatic vessels or nodes, which is called primary lymphedema, causing a chronic inflammation with reactive fibrosis. Obesity will be defined as a progressive chronic disease characterized by abnormal or excessive accumulation of fat that poses a health risk. And lipedema is a chronic, painful, and progressive disease characterized by abnormal and symmetric accumulation of adipose tissue in the extremities. And most likely, the head, neck, the trunk, feet, hands will not be affected in lipedema. So the signs and symptoms for lymphedema, we'll see chronic swelling. So in the early stages of lymphedema, we'll have pitting edema, what we see in the picture. So when we press and we have an indent, this is what we call pitting. And the patient in the early stages and later stages will also complain of heaviness, tension, or stiffness in their limb. The skin will mark easily under pressure. Flexibility can be reduced. They will be at the higher risk of infection, which the cellulitis, not the aesthetic cellulitis, but infectious. And the clothes and jewelry will feel tighter, and pain might be present. So for obesity, obesity is defined as a BMI being over 30 with an accumulation of body fat, and more dangerous if the fat is located in the abdominal region. The person could have difficulty moving, joint pain, sleep disturbance, metabolic complications like diabetes or hypertension, and irritation or infection in the skin folds. And lipedema is pain, is defined with pain, and it's pain to touch, like the fat will be painful. So the hands and feet will not be affected, and usually you can feel nodular fat. So you feel on the skin like either like a rice or a bean shape that you would not normally feel on normal skin. The person will have difficulty losing weight in the affected area. Often there will be easy bruising. And what is a main thing also about lipedema is that you have a symmetrical presentation of the lower limbs or arms. And the lower limb musculature is poorly defined, and the kneecap is not visible. So for lymphedema, we classified it in 4 stages, with stage 0 being something that is not visible, but the person will start complaining about the heaviness, for example. And lymphedema can affect any part of the body. Obesity is more likely defined in the literature through BMI, and the distribution will be generalized. One thing to consider, though, when we look at BMI is that it can mislead because BMI doesn't take into consideration your fat distribution, your age, your sex. So if we look at those 2 young men at their time, they would be considered as being obese, but technically we could see that they're not. So BMI could be misleading. And other measurements like hip-waist ratio are more appropriate, and particularly when we talk about lipedema. So lipedema will be defined under 4 stages and under 5 types. And most types will be type 2 and type 3, which will affect the hips to the ankles. And when the arms are involved, more likely to accompany a type 2 or type 3. Different distinctions. So in lymphedema and obesity, women tend to be more affected by lymphedema, and obesity it's about the same, but women will present with more abdominal obesity, whereas men will be a more generalized obesity, and lipedema affects mostly women. One other thing is the distribution. So most likely lymphedema, secondary lymphedema and primary lymphedema will be unilateral. And if it's bilateral, it will be presented in an asymmetrical way. Obesity will be presented in a generalized way, and then lipedema will be symmetrical. So the feet and hands involvement will be frequent in lymphedema, possible with obesity, and rare with lipedema. Pain to touch, this is one of the big characteristic and distinction. In lipedema, it will be present, like even a sheet from when you sleep can be painful. So women will complain they cannot tolerate, or they have difficulty being touched or being squeezed, or just holding their child on their laps. That's one thing to consider in lipedema. Bruising will be present only in lipedema, irregular bruising, I would say. Tissue consistency, so at the early stages, lymphedema will start being soft edema, and then as the disease progresses, it can become fibrotic. And with obesity, it will be like a soft fat consistency, and in lipedema, you'll have the nodular and firm fat that you will feel under your fingers. Stammer signs will be like at the base of the second toe, where you try to pinch, as we can see here on the left foot. We have a positive sign where it will be difficult. And so this is a classical sign for lymphedema, and it won't be present for both obesity and lipedema. And weight loss in lymphedema, I say variable. So yes, if obesity is present with lymphedema, it will have an overall reduction, but lymphedema will not resolve. So like similarities between both limbs will remain about the same. So if you had a 15% difference lymphedema, the fact that you're losing weight, this 15% will remain, even though there's some weight that is less. And in obesity, it will be an overall reduction. And with lipedema, also there will be a minimal effect regarding losing weight, because as we can see here on the picture, we have a lipedema leg. So lipedema, as we can see next, will not disappear. So this young lady with anorexia, we see that she's tiny and quite petite upper body, but the lipedema did not disappear. There are some cases where it combines everything. So lymphedema started in relation to the obesity and the lipedema that is present. And what we don't see also in this picture, there's another thing going on with this women is venous insufficiency that she has as well. So like sometimes, yes, there are three distinct conditions, but sometimes what leads to the misunderstanding is that they coexist, but they need to be addressed separately. So how do we treat lymphedema? So MLD can be used or as needed. Most of the components that will be important is the self-management in regards of education. Compression is the key element in treating lymphedema. Movement as well. So skincare, nutrition, and in some instances, we can use specialized surgery. but it's in a well-chosen patient. Obesity, quite often the first part will be addressed with nutrition, physical activity, pharmacotherapy, added or not with bariatric surgery when indicated, and compression if indicated. And lipedema, we will use compression, pain management, adapted exercises, nutrition, psychology, pharmacotherapy with a question mark, because there are some evidence that are coming up in regards of the use of GLP-1. So that's to come. GLP-1, yes, can be used in obesity, but there are some evidence that are saying that even though it will not reduce the obesity and lipedema, it reduces the symptoms. So I'll be curious to hear more about it with the upcoming Congress in Winnipeg for the lipedema. And quite often, lipedema will be addressed also with specialized liposuction in not well-chosen, but in persons that are not having success with the conservative approach. So with compression, how to deal or put the right compression. So most of the time in early stages of lymphedema, we will use standard compression. Some particular cases may need a custom made, but most likely will be well addressed through a standard garment and a lower compression of 20-30. Stage 2 and 3, ideally, we use custom-made garment with classes 20 to 30, 30, 40, or even 40, 50, and it will address all body parts. So obesity, we will use a standard or custom-made garment, no matter, not that doesn't matter the compression class, but what needs to be addressed is, even though there's a larger body composition, which we often think that a firmer compression will be needed, sometimes we need to decrease the compression just because that the person doesn't have the strength to put it up. So often we will reduce compression, but can superimpose two garments as an option to address a better compression. And with obesity, we will use either knee-high, thigh-high, capri or leggings, or with panty. And lipedema, stage 1, we will use a standard or custom garment with a lower class, and stage 2 to 4 custom, either 20 or 30 or 30-40. And the thing is, there's no magical number. The best compression that the person will wear is the one that she will put on and not be left in the drawer. So even though we recommend custom, sometimes we need to tweak around and find the best solution that the person will be willing to wear compression and will have something to start with, and maybe later on progress with a more efficient garment. So the Curaflow is one of the good garments available. It's so soft to touch. So you have the smooth microfibers that are there that make the garment just simple to put on and really comfortable to wear. It also has an extra soft area behind the knee to give you the more mobility and comfort that you could have. And it's a medical garment, so the pressure will be constant, and ideally, and it will be done longitudinally as well, so it will hold quite well on the limb. You will have a perfect and custom fit, as it is a custom garment. It is a quite breathable and moisture regulating knitted fabric that ensures like a really excellent wearing comfort, and smart longitudinal structure for perfect lymph transport. So when you look the way the Curaflow is done, when you stretch it, you'll see that you have low and high level, so which plays with the pressure, and it's done longitudinally. So it's one of the best way to address the lymphatic flow and make sure that everything gets out of the limb and you addressing well your lymphedema. One thing that also there's a lot of questions for both lymphedema, lipedema. Should I use pressotherapy, a compression pump, or however how you want to call it? So, and there's a lot of things available on the market that it's like you make it all easy. You can even buy something at Costco for a cheap price, but I wouldn't consider those machine because those can be harmful to the lymphatic system. So you want to, as for me, as I'm dealing with a medical condition, I want to address the condition with a medical device. So the Lympha-mat is a medical device that has 12 chambers that are overlapping. And the way that the overlap is done is made that it will smooth and ease the lymphatic flow and to get out of the limb. So the pressure will not be like straight, it will be like an angle to really facilitate the movement. The pump can be used in a reduction or maintenance phase, and it's a support for self-management. And one question is like, okay, how often do I need to get into the pump, or how many times I should use it? Everything needs to be personalized. So it depends on the weather, depends on your limb, so the time that you have available. So maybe one day you have 15-minute slots, and the other day you have 30 minutes. So you play with what you need. So you personalize, and also the pressure that you put on, it's based on your tolerance. Some will even go into the pump with their compression garment. So therefore you reduce the pressure that you could put on. So pressure can be from 20 to 100, and the time from 15 to 1 hour. So you can play yourself with that. And then you have different sleeves that can be used. So ideally for lipedema, lymphedema, you would use full sleeve. So that like the panty or like the vest for if you have breast cancer related lymphedema. So proper sleeve, just to make sure that you get the full massage and the full movement, and it's a complement of therapy. So one of the key messages that I want to leave you is like lymphedema is a chronic disease of the lymphatic system. Obesity is a chronic metabolic disease, and lipedema is a chronic disease of adipose tissue. So yes, lymphedema, obesity, and lipedema, the three are distinct, but they can coexist all together. And we need a rigorous clinical evaluation in order to better address those person living with the conditions. And compression will play a major role in self-management. And in an ideal world, also, a multidisciplinary approach is required to optimize the outcomes, and multidisciplinary because many things can be faced with those persons. It can be, yes, the physical limitations, so either like the physiotherapist, kinesiologist, a massage therapist dealing with lymphedema, but also sometimes you need more. You need a psychologist or different things that are rarely addressed for these three conditions, sex therapist, so nutrition advice. So a multidisciplinary team is ideal to address the different components of those conditions. And here is our number. If you have questions or information, feel free to communicate with us. And here is the references. And I think I in French, I covered a bit longer, but as it's in English, I think I didn't say much detail. So we have more times for questions, I guess.
Thank you so much, Maria. This was an excellent presentation, and I know that this is a topic of great interest to our audience. And we really appreciate you sharing your expertise with us. So yes, at this time, we'll move right into our Q&A. The first question is from Monique. She asks, do you think manual lymph drainage helps lipedema patients?
Yes, MLD can help in many ways, but if we think that MLD will cure lipedema? No, but MLD can be used to reduce pain symptoms. If edema is present, it can help to manage that as well. So to relieve just the pain that it bring, not the pain, the relief of pain that can be done through MLD, that can be used. But I wouldn't use MLD as the thing that needs to be done first. Like compression, nutrition, exercise, that will be my first thing. And then if needed, MLD can be done.
Okay, great. Sharon asks, can lymphedema cause fat deposits?
Yes, lymphedema can cause fat deposits. So in the later stage with what we call lymphostasis. So as the disease progresses, the fact that the lymph is staying there, it will change the tissues that are around. So it's called adipogenosis. So yes, in the later stage of lymphedema, the liquidy part of it will be transformed into fat. But it will be a different texture. Like it would be like a firm fat, not as a lipedema fat.
Okay. Carol states that there's conflicting information published about whether lipedema exists. As we wait for clarification from research, what is the best way to advise patients?
This is a tricky question. So technically, yes, lipedema is being recognized with the WHO and their like big dictionary called ICD, and they are at version 11. So in version 11, lipedema is being recognized. But in Canada, we're back in the old days, we're at ICD 9, and some provinces maybe at ICD 10. So there's not a proper recognition, but globally, worldwide, it has been recognized. And there, like we can see, there are two different point of view. So there's the ILA group and the LWA group. So depending on who you're following, the thoughts are different. So both have goods and I don't want to say bad thing, but like I think a vision of both team could be somewhere to build from. Everyone's sharing. Like the thing is to build up on a conversation, and you may have a different point of view, but down the road, I think as the WHO recognized lipedema, I do think that it exists as well.
Great. And just to kind of build off this question from a patient from Quebec, asking if lipedema is reversible or curable.
I wish. Unfortunately, no. Lipedema and lymphedema can be helped quite a lot through movement, but also nutrition. So we see a lot of things going around low inflammatory diet. So there are some evidence emerging that it's helping, but as everything, like there's no like a stem proves like, okay, this needs to be done. So it's still emerging, still to be worked on. You can reduce your symptoms by having less inflammation. So that will improve your capillary return or reducing the bruises that you will have. But down, like in the bottom of the root, like lipedema will still remain present, unfortunately.
Question from Denise. What are you and your patients' goals for rehabilitation therapy for women with lipedema, and how are they justified for a medical payer such as insurance?
That's one thing. In Quebec, medical insurers, they're not that present in the clientele that I'm seeing. So we work on what we can and what they want. So the goals will be to be addressed like, okay, is it a pain reduction? Is it mobility that you want to regain? Is it volume reduction if lymphedema is present with lipedema? It's just education, skin hygiene. I'm not a nutritionist, but like sometimes to direct to someone with a better knowledge in nutrition, like to to individualize, I can talk about exercise. So depending on what they do, so different things to consider. So it's really based on the person. And then even if for me, I'm seeing that the person has like a severe lipedema or like a lot of edema that is present as well, but they don't care. They just want to move around or like do something like, okay, so my emphasis won't be on what I think would be the best, will be a communication and define with the person objectives. So I didn't answer that question clearly, but it would be definitely based on the patient's preference and need.
Absolutely. So we do have some live questions coming in. So a question from Jasmine: how important is elevation in conjunction with compression, nutrition, etc., in managing lymphedema?
Elevation is a good point to start with also, because what we see in the early stages of lymphedema, stage 1, for example, it's reversible with elevation. So that can be done along. Also, patients with later stage can feel some of a relief with elevation. Not much as you progress further and the lymph being heavier, but early stages, like beginning of stage 2, also can beneficiate as well from elevation.
Okay, so we also have a question from Sharon asking, what are lipomas?
Lipomas is a different thing. Like it's a fat. It's a more like a fat, not a bubble, but like it feels like an egg under the skin, like build up. I don't have the proper definition, but it's more like a long-standing fat deposition.
Great. We had a question come in from Allison. Do you need a medical referral or consultation for a compression device like you showed? She's wondering if it would help her and to know what pressure and how many times per week to use.
Yeah. As lymphedema, lipedema are a medical condition, yes. Well, for me here in Quebec, for compression, and you need a prescription. So that will be ideal, because we also need to rule out that you can be in compression. So there is no contraindication to that. Like, do you have a heart failure, for example, that wouldn't be suggested that you go into a pump. Or do you have a, like on the spot, like a DVT or a cellulitis? That would be like, the cellulitis will be contraindication on the spot, but if you have a DVT, you wouldn't go into the compression system.
Okay, wonderful. You did touch upon this a little bit in your presentation. A question from Lori asking about what studies have been initiated regarding the use of GLP and GLP-1s in lymphedema and lipedema. And if there's anything you'd like to add to kind of speak on some of the early results from these studies.
I think things will be coming up, newer studies from GLP-1. So I had the opportunity to go to the Lipedema World Conference in Rome in November, and I was impressed, and I wasn't aware of that literature at all. I couldn't go in the full session on GLP-1, but yes, they were showing for those suffering of obesity on top of lipedema, it could bring some results. One other thing also is, even though it wasn't affecting their obesity, it was affecting their pain. So there are things in that regards. But the thing is, GLP-1 is not a quick fix, or it's something to consider, because you have side effects. So one of them is the sarcopenia. So sarcopenia is a muscle loss. So yes, you're losing weight, but you're also losing muscle. So if you're using GLP-1 and not doing any exercise on top of that, like, it can be problematic down the road. So I think there will be new evidence coming up. I know that the conference in Winnipeg definitely will have a session on that. So I'll hope I'll be able to get more information. But I would say that it seems to have some interesting results coming from that literature.
Wonderful. Another question from Eric. Chronic disease, chronic therapy. What should we do to stay in touch with the patients?
Yeah, that's a difficult one. Lifelong management is, so you have someone coming to you and you know that the minute that they're passing your door, you'll be stuck with you for a good part of your career. It depends the follow-up that you need. So at one point, it might be just once a year touch base that you educate on something, or let the fact that you're reading all new research so you can bring the thing. Other will need continuous education because they put their compression wrong, because they just cannot do it on themselves. So to stay in touch with the patients, I would say communication, and sometimes just on even though if they don't come to your clinics, like you teach them to do their self measurements. And so if 1 month they see that it's not going well, they can call you and just have an open discussion. But communication.
Wonderful. Well, thank you so much, Maria, for joining us this evening. And thank you so much for everyone who also has joined us. Before we wrap up, I just want to express my gratitude again to Bauerfeind Canada for their continued support of the lymphedema community, and how your partnership makes it possible for us to provide valuable education like tonight's session. Again, for those who submitted questions, we appreciate your engagement. If the Bauerfeind team wasn't able to get to your question tonight, remember that we will be following up with contact details for Bauerfeind Canada so you can connect directly. And don't forget, we'll also be sending out a recording of this webinar over the next few days. Lastly, I just want to say a big thank you to my colleague, Bonnie Baker, the Executive Director of the Canadian Lymphedema Framework, for your support on coordinating this webinar and for all of your work behind the scenes tonight. So that concludes our session for this evening. Thank you and have a wonderful night.